Good morning, I'm Rebecca. I'll be your sleep nurse today. I'm going to perform hand hygiene and provide privacy for you by closing the door. All right. Could I get your name and date of birth? Can you verify that? All right, Ferdinand Foley, September 23rd, 1969, and that does match the order that I have for you today. Oh, Mr. Foley, do you, oh, can you rate your pain? Are you in any pain today? Can you rate your pain on a scale of 0 to 10, 10 being the greatest and 0 being no pain at all, and to 0? Okay, I'm gonna get your bed up to a working position. Also, Mr. Foley, do you have any allergies? Yes, you have a sulfur allergy. Okay, I'll take note of that. All right, so today we'll be doing a cardiovascular peripheral assessment on you, and that's just me checking your heart and your lung sounds, and checking your circulation in your extremities. It'll take about 15 minutes. Is there anything I can do for you before we get started? Anything to make you more comfortable? Do you need to use the bathroom? Okay, nope. All right, so I'm going to go ahead and lay the head of the bed down to 0 degrees. And while I'm doing that, I'm gonna check your jugular veins. I'm going to touch your chin and turn it to your left and back to your right, assessing for any pooling. And I do see that there is pooling in the veins there. So I'm going to raise the head of the bed to about 30 degrees. All right, I've raised the bed to about 30 degrees, and I'm gonna go ahead and assess that area again, checking your jugular. I do see that the veins are no longer distended, and there's no JVD noted, no pulsations, and that is a good normal finding. All right, Mr. Foley. Now that I've inspected it, I'm going to go ahead and listen. I'm going to auscultate with the bill of my stethoscope, and I'm going to listen. Can you hold your breath? All right, I'm going to listen to your carotid artery. All right, and I'm going to listen on this side, and I need you to hold your breath one more time. All right, and I've listened to both sides and everything, and I don't hear, there's no brewery noted. Okay, I'm gonna go ahead and palpate your jugular, your carotid artery, and it is 2 plus amplitude normal, and the opposite side, the right side is 2 plus amplitude, that is normal, regular rate. I'm gonna go ahead and assess your trachea. Your trachea is midline, no deviation noted. So I have inspected, I have auscultated, and I have palpated. All right, Mr. Foley, so I'm going to check your skin, and I'll go ahead and check your heart rate. Okay. Your skin is warm and dry and appropriate for your ethnicity. Okay. We're going to listen to your heart. I'm going to start with the bill of my stethoscope, and I'm going to listen to your apical in your right second intercostal space, your pulmonic, which is in your left second intercostal space, and I'm going to listen to your fourth left intercostal space and to your tricuspid valve. I've already listened to your aortic valve, your pulmonic valve, and this is your tricuspid valve. And we're gonna move over to your fifth intercostal space on your mid-clavicular line, and listen to your mitral valve. Everything sounds clear. We're gonna turn over and listen with the diaphragm. We're gonna do your aortic valve in your second ICS, your pulmonic valve in your left second intercostal space, your tricuspid valve in your fourth left intercostal space, and in your fifth left intercostal space on the mid-clavicular line. I'm going to go ahead and get your pulse in the apex or your mitral valve, and the pulse rate is 80, and that is a normal finding. All right, I'm going to come down just a little bit more, and now I'm going to listen to your lungs. Okay, so to listen to your lungs, I'm going to also use the diaphragm of the stethoscope. I'm going to listen to your anterior first. I'm going to start above the clavicle, and we're going to listen to all 8 anterior locations. So 1, 2, 3, 4, 5, 6, 7, 8. Everything sounds clear. I don't hear any fluids in the lungs on the anterior. While I'm gonna go ahead and check your posterior lungs, and I'm gonna have you just roll over for me, and I'm gonna cover just a little bit, and I'm gonna check the 10 posterior points for your lung sounds with the diaphragm of my stethoscope, and that's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Everything sounds clear back there. No adventitious sounds. Now I'm going to do your lateral. I'm going to start on your right. So I'm going to go 1, 2, 3, working my way down, 4, 5, 6, 7. Lungs sound clear. No adventitious sounds. Everything sounds clear. Don't hear any fluid in the lungs. Your AP ratio is a 1:2 ratio. Your AP to lateral ratio is 1:2. All right, Mr. Foley, we've assessed all of your heart and your lungs. Now, let's come back up, and I don't see any circummoral cyanosis around your mouth. That is a normal finding. That's good. I'm going to go ahead and check your pulses. I'm going to start with your brachial pulse inside of the elbow. I'm going to go ahead and assess that. And your brachial pulse is 2+ amplitude and regular rate. The radial pulse is right above your thumb, so that is 2+ amplitude, regular rate. Your femoral pulse will be in your groin area on your inguinal fold. I won't palpate that today, but I will. So I'm gonna go and move down to your lower extremities, and I'm going to assess your popliteal pulse. That is right here behind your knees. I'm going to have you slightly bend your knees, And your pulse rate is 2 plus amplitude, regular rate in your popliteal. Are you having any tenderness or pain in your calves? No, so I'm gonna go ahead and patient states no. So I'm gonna go ahead and inspect the calves. I don't feel any abnormalities or lumps or anything in the calves. There's no tenderness, no swelling. I'm gonna check for edema in the shins. So start with the ankles and move my way up. There's no edema noted. I'm gonna check your posterior tibial pulses, and they are 2 plus amplitude bilaterally. I'm going to check your dorsalis pedis pulse between your big toe and your first toe, and it is 2 plus amplitude, regular rate bilaterally. I'm going to go ahead and check for toes and or your feet for cyanosis. There's no sign of cyanosis in your feet. And I'm going to check the capillary refill in your feet. And I'm going to check for clubbing. No clubbing noted, no visible signs of clubbing. Your capillary refill is 2 plus amplitude. I'm so sorry, it is not 2 plus. Your capillary refill is less than 2 seconds. It is brisk, and that is a normal finding. And I'm gonna cover your feet back up. And I'm gonna check your capillary refill in your fingers, and also check for clubbing in your fingers. Capillary refill is brisk and less than 2 seconds. That's a normal finding as well. Skin is warm and dry. No cyanosis noted. I'm gonna check for clubbing. I'll have you make a diamond shape, or make a heart shape with your fingers. Put in the 2 index fingers together, and I do see a diamond window indicating that there is no clubbing in the hands. All right, Mr. Foley, I think we've covered everything. Can I get you anything else before I go? Can you rate your pain on a scale of 0 to 10? It's still at a 0. Okay, I'm gonna put your bed in a low lock position. I'm going to leave your head of your bed at 30 degrees. And I'm gonna put your call light in your hand, ensure that it's working and it's there. And I am going to perform hand hygiene, and I will see you later, Mr. Foley.